New year and definitely new skincare trends, but not all of them are doing your skin a favor. Hi everyone, I'm Dr. Mara Weinstein. I'm a board certified dermatologist. And today I'm breaking down some of the best and worst skincare trends we've seen in 2025 so far. From the overhyped to the downright dangerous, let's talk about what's trending, what can be beneficial, and what absolutely needs to stop. Absolutely love hypochlorous acid. It is so good to use after the gym, on irritation, on wounds. It's a wonderful ingredient, and I think it should be in everyone's gym bag, especially, and also in every mom's bag because it's great to use on your kids. It's actually anti-inflammatory and has some antimicrobial properties, and so hypochlorous acid was trending early on in the year, and I'm totally on board with this trend for sure. Hydrogel sheet masks have been all the rage this year, and I actually think they can do some really nice things for the skin. Now, leaving it on overnight and sleeping in it concerns me a little bit because there might be some ingredients that could potentially become irritating to the skin, or if you have sensitive skin and there are some inactive ingredients in that mask that you could react to, then by the time you wake up in the morning, you are not going to be happy. But in this video, it looks like she's putting the mask on and then she's going to sleep in the morning. It has turned clear and it has been fully absorbed. I think there are some really great moisturizing properties to this type of mask, but I don't think it's a permanent fix for pore size or achieving that glass skin. Really, you need a lot more of a regimented skincare routine to achieve these results in a more reliable way. But I think for a once a week or maybe for an event, this is a nice alternative. Guys, I am so sick of people trying to find alternatives to Botox. Botox does one thing that nothing else can do. It essentially stops the nerve from talking to the muscle. And so all of those repetitive movements that we make throughout the day with normal facial expression are going to be softened with a neuromodulator like Botox. Now, you can use silicone tape. It has wonderful hydrating properties and can be very helpful in the short term. But in the long term, you're still going to develop those etch lines. You're still going to smile, raise your eyebrows, furrow your brow, and all of those lines over time can become etched into the skin if you don't choose something that actually modulates the way that the muscle is moving like a neuromodulator. We've said it time and time again, less is more. This routine concerns me. While I love the products and her enthusiasm for ingredients, it's definitely not necessary to put 50 toners on the skin and 2 cleansers and multiple moisturizers and peptides and a prescription retinoid. It is just way too much, especially if you're new to skincare and you're looking for a nice place to start. It really doesn't have to be this complicated. Plus, if you have sensitive skin, more than likely a combination of all these ingredients will cause some sort of sensitivity or irritation. Oh my gosh, I can't believe she is still putting things on her face. The other thing that concerns me is when you layer products, you don't know how much you're diluting or losing some of that efficacy in the product. Now she has 2 milky toners. I don't even know what those are going to do. They might just sit on top of the skin at this point. There is way too much going on here. Keep it simple with your skincare. Liquid microneedling. Okay, I've heard this term before. It kind of concerns me because I don't know what's in the product that's creating those little microfibers or abrasiveness. However, I do love this brand Medicube and I do love the concept of exosomes. So there could be something to this. I'm just not so sure that this is the right way to go about it. Now, exosomes are an amazing product that have blown up in 2025. There are still so many questions though, like how they're manufactured and how they are packaged, and if once they're packaged, they're still efficacious. And so exosomes can be used with a microneedling device. Typically, we do that in the office where we would microneedle the face and then use exosomes on top in a reliable serum form. In this case, there are 2 products that are being layered. One is an exosome product and the other a cream. And as a refresher, exosomes are extracellular vesicles of a certain size that carry cargo, so they can deliver repair signals to damaged skin cells. I use them a lot in the office for hair. In this case, we're just talking about facial rejuvenation. I think there's a lot of promise with exosomes. I don't know if we're there quite yet, but I'd love to see some more clinical studies and data on seeing really what they can do for the skin, especially in a packaged form. When did ChatGPT become a life hack for skincare? I am flabbergasted. I have definitely heard this before where people are submitting photos of rashes to ChatGPT and asking for a diagnosis. And here she's submitting photos of her skincare and asking for a skincare routine. I, again, am flabbergasted. I think this is really scary. It's taking that human interaction out of something that's very personal, which is your skincare. It is taking away the credentialing and education of a physician. ChatGPT, I think, can be beneficial for many things, but for crafting the perfect skincare routine, be very cautious. If I had a confession box as a derm and I could confess one thing, I would say I actually love vampire facials. Now, it sounds scary, but when done in the appropriate, sterile, medical setting, it can be really beneficial to the skin. We draw the blood, we spin it down, we use a sterile microneedling tip, we apply the PRP, which is platelet-rich plasma, to the face, and use it as a product to help with facial rejuvenation, wound healing post-procedure. It can be a really nice glow-up procedure pre-wedding. It can also be a really great procedure just to maintain your skin. I've been using it a lot for patients with pigmentary issues. So I secretly love the vampire facial when it's done in the appropriate clinical setting with the appropriate depth settings. As a mom of a preteen myself, I was particularly impressed with this mom's routine that she built for her daughter. I think all of the products chosen are appropriate, gentle enough for preteen sensitive skin, and also will just help her get into a routine. At this stage, it's most important that tweens and preteens and adolescents in general develop healthy skincare habits rather than picking products with a ton of ingredients. And so this mom did the right thing, spot on, bravo. Hydrocolloid patches are such a great way to stop picking your pimples, and that will prevent a whole downward spiral of inflammation, worsening of the pimple, and then potentially scarring. So love hydrocolloid patches. I think that's the right move.
Ceramides and peptides are ingredients that everybody should be using. Ceramides are fatty acids that are going to help hydrate the skin and improve.
Great information really about ceramides and peptides. I counsel patients all the time to include ceramides and peptides into their routine. Now, I don't think these ingredients are meant to be standalone skincare ingredients. While they have a ton of benefits for the skin and are generally formulated in products that are appropriate for sensitive skin, they do provide a lot of hydration benefits as well as promoting collagen production, but there might be a few other things that I would throw in there. But the two things that I would add to this routine with ceramides and peptides are sunscreen and vitamin C. Gotta have those. Well, I'm all about saving money. I do not trust anything DIY when it comes to sunscreen especially. Well, she's got that ingredient right. Zinc oxide is a key component of sunscreen, but when thrown in a jar with, I don't know what else is gonna go in here. Let's see. A bunch of different oils. See, the thing about DIY is you can have all the right ideas in mind, but you don't know that when you throw all those ingredients together, are they all gonna be effective as one sort of DIY soup? And that is why it is so important to stick to products that have been thoroughly vetted, researched, and tested to be efficacious and safe for the skin. Now, sunscreens received a bad rep because now we've all heard the misconception that sunscreen can cause cancer. We know in those studies the amount of sunscreen that was used was way more than we use typically on the skin, and really anything can cause cancer, so I don't buy that argument at all. When it comes to buying sunscreen and DIY skincare, stick to things that are thoroughly vetted, researched, clinically proven and effective, and recommended by your board-certified dermatologist. If you want to save money, there are affordable skincare options out there. Honestly, there's no sunscreen that has to break the bank. But if you like mixing sunscreen soup, then go right ahead. But if you still get burned, your risk for skin cancer is still increased, and I'll see you in the office in a couple years.